Let's talk about a new way for cities to tackle their most stubborn problems. You know the ones: housing, public safety, jobs. What if there was a new playbook? And what if your most powerful partner was someone you see all the time, but maybe in a completely new light?
I mean, think about this question for a second. We see hospitals as places that fix us when we're broken, right? But the reality is changing, fast. They're now being called to step outside their own walls and help fix entire communities. And this isn't just some feel-good idea. It's a massive shift in how we can build healthier cities from the ground up.
Because here's the thing that city leaders and healthcare folks are really starting to get. Those persistent neighborhood problems, they're not just civic issues. They're actually public health crises playing out in slow motion. Things like unstable housing, or not enough local jobs, or struggling schools, these are the very things that are making people sick in the first place.
Okay, now check this out, because this is what really blows my mind. We all think that being healthy is about doctors and medicine, right? But look at this chart. Access to healthcare is just a tiny sliver of the pie. The vast majority of what determines your health is your neighborhood, your job, your social connections, your education. It's everything outside the clinic.
And there's a name for all this stuff: social determinants of health. SDOH for short. It's just a formal way of saying that the conditions where we live, learn, work, and play have a huge impact on our health. This is the critical link. It connects the well-being of a whole neighborhood directly to the health of every single person living there.
So, if all those community issues are what's really driving health outcomes, who's supposed to help a city fix them? Well, this is where that untapped partner comes into play. Hospitals are waking up to the fact that they can't make their patients healthier in the long run if they just send them back out into an unhealthy environment.
And this slide just lays out that evolution perfectly. The old model, totally reactive. You wait for a sick person to walk through your door, you treat them, you send them home. The new model is proactive. It's about getting out into the community to tackle the root causes that are making people sick, which helps everyone, and frankly, it helps manage costs. For a lot of hospitals, this isn't a choice anymore, it's just becoming a necessity.
So what makes a hospital such a game changer for a city? Well, it's not just about the money, though that's a huge piece of it. A lot of nonprofit hospitals actually have to invest in community benefits, which creates this perfect stream of funding for this kind of work. But it's so much more than that. Think about it. They have incredible expertise in finance, in leadership, in marketing. They have trust. And they have this unique power to get all the other important players in a city to sit down at the same table. Okay, so that's the why. We get it. Now for the how. The playbook for making this hospital-city partnership actually work is a really clear two-pronged strategy. It's all about mobilizing the two most critical groups in any neighborhood: the people who actually live there and the organizations that are already working to serve them.
Strategy number 1 starts with the people. You absolutely cannot fix a neighborhood from the top down. It just doesn't work. The playbook says you have to help residents organize themselves, train them to be effective leaders, and then, and this is key, let them create their own improvement plan for their neighborhood. That's how you build real partners who are invested in the goals, because they helped create them.
Now, the second strategy zeroes in on all those community nonprofits that are already doing the work. The goal isn't to replace them, it's to make them stronger. So the playbook says, first you got to understand who's out there. Then you bring in experts to help them get better at what they do. And only then do you make strategic investments. You're basically building a superpowered army of capable partners on the ground.
Having a brilliant strategy on paper is one thing, but making it work in the real world, that's a whole different ballgame. So let's talk about the key principles that turn this playbook from just a document into real, measurable impact for a community.
I love this quote because it is just so brutally honest. Success is not about a hospital or a city just cutting a check and walking away. If you don't build up your partners first, if you don't have that relationship and a rock-solid plan, you're basically just hoping for the best. This has to be a partnership, not just a transaction. And here are the ground rules for making this all work. Number 1, focus. Don't try to boil the ocean. Pick one area where you can make a real, visible difference. 2, use data for everything. Let it guide your decisions and show you it's actually working. 3, bring everyone to the table. No partner is too small. And finally, number 4, the hospital can't be a silent partner. It has to be an active, hands-on leader in this whole effort.
And this right here might be the most important thing to remember. The problems are all connected. You can't just focus on housing and ignore the jobs problem. You can't just focus on jobs and ignore education. A successful response has to be coordinated, hitting all of these issues at once. It's like a big puzzle.
You need all the pieces. So when all of this clicks into place, what does success actually look like? Well, when a city and its hospital truly partner up, they create this amazing win-win. They're not just putting out fires, they're building the foundation for a community that can actually thrive for the long haul. It all starts when people feel connected. When neighbors are organized and looking out for each other, you get the foundation for safer streets.
And that stability, it just radiates outward. A stronger, more supportive community leads directly to better schools for the kids.
And with those stronger community organizations in place, smart investment now has fertile ground to grow, which means more local jobs.
And by building up those nonprofits, you can finally start to tackle the really big issues, leading to more stable and affordable housing for everyone. And when you put all of those pieces together, the safe streets, the good schools, the jobs, the housing, you get the ultimate prize. You get healthier people. You're not just treating sickness anymore, you're actually building health.
This whole playbook really creates a new way for city leaders to think. It shows that one of your most powerful allies for revitalizing neighborhoods might be that big building you've driven past 1,000 times. You've always seen it, but maybe never as a partner like this. So, the only question left is, who's the first partner you need to call?